Hello, my name is Dr. Brandon Gardner. I'm a general dentist here in Boerne, Texas, and today I'm talking with my good friend Dr. Alfonso Monarres all about full mouth dental implants, which is commonly referred to as the all-on-4 procedure. Now, Dr. Monarres is a board-certified prosthodontist, and he practices in the Stone Oak area of San Antonio. His practice is limited to dental implants and dental implant prosthetics, and really they are highly focused on helping their patients achieve a beautiful, healthy, long-lasting smile utilizing dental implants and the all-on-4 procedure. Dr. Monarres and his team have completed thousands of these cases, and I'm very grateful to have him here as my guest today. Dr. Monarres, welcome.
Thanks for having me, Dr. Gardner. What a great pleasure to be here with you today.
Well, let's get right in. What is the all-on-4 procedure, and where does it get its name from?
The all-on-4 procedure is a great technique that you and I utilize to replace teeth with dental implants in one day. It gets its name because it utilizes only 4 dental implants, which is one of the reasons why it became a great advantage for patients. Back in the days when patients needed to replace a full set of teeth, they would do it with 1 implant per tooth, or at least 8 to 10 implants, and quite often those patients didn't have the bone available to do all this, and they wouldn't require to have bone grafting procedures and to wait wearing dentures, and that's not comfortable. That's a very long time, and it adds a lot of cost to the treatment. So the all-on-4 procedure has really allowed us to change the way we do dentistry in benefit to patients, and using different angles to connect a full set of fixed teeth the same day. And what that means is, great benefit for patients that have suffered for a long time, and they can come to our offices and in one day walk out of the clinic with a brand new set of teeth supported by 4 implants in a much shorter amount of time, in a very comfortable way, since these patients are sedated, and in a much more affordable price for them.
So I heard you say a few times to get all these teeth in one day. Is that really possible? I mean, you hear commercials and infomercials out there talking about teeth in a day. What is that really what's happening here?
It's true, but obviously there's a little bit of a misconception. Patients come to our offices in the morning and they leave the same day with a brand new set of teeth. That is true, and that can be done. However, there's a lot of preparation that needs to be done before, right? To do something like this, it's very important that you and I, when we work together, we get together and we plan these cases to be able to help patients to achieve their final results. So there's the diagnostic phase, the planning phase that needs to happen before the big day. Now, yes, patients come in one day, early in the morning, they get sedated, and by the end of the day, they walk out of here very happy and smiling. But the other part is nobody can make the body heal that day. So it's not like we never see the patients again. Obviously, we're going to see the patients 2 or 3 times during the next 4 months to make sure everything heals very well, that they're happy, that they're comfortable, and at the end, we fabricate a final prosthesis to make sure they love their new teeth.
That's awesome. Those results are just beautiful. They speak for themselves. So many people are familiar with a denture or a partial denture. It sounds like really there's not a fair comparison between a denture and this type of procedure. What are some of the key differences?
Well, Dr. Gardner, you know that for many, many years, the best thing we had in dentistry was to save as many teeth as we could and then replace the other ones in the best way we could, available for us. So we did a lot of partials and a lot of dentures, because a partial or a denture, it was better than nothing, right? But we know, like the patient here, that partials are not comfortable. They look like teeth, or dentures. They look like teeth, but they don't function like teeth, they don't feel like teeth, and patients have a really hard time getting used to them. Some of them can, and some of them can never really feel normal with these partial dentures. Now, with dentures also, the roof of the mouth is covered, there's a lot of plastic around, and patients lose their perception of tactile perception, of texture, temperature. They can taste food really well, and they're always like afraid of losing their prosthesis when they go to a public place. If they laugh, if they sneeze, if they yawn, if they whistle, these teeth can fly out across the room, and that's a very embarrassing thing for everyone. So with the All-on-4, we're able to anchor teeth in the jaw bones the same day and eliminate all these problems. So there's really not a fair comparison, because the All-on-4 and the replacement of teeth with implants, it's really like having natural teeth again. They feel, they function, and they look like teeth again. Whereas traditional dental prostheses like partials and dentures are really just a substitute for natural teeth, but they have all the disadvantages that I just mentioned. So it's really night and day.
Yeah, that's great. Now, as people listen to this and they see these pictures, what types of patients are best suited for the all-on-4 procedure? I know I talked to a lot of different types of patients who maybe have some teeth and or maybe just sick of what they have, or maybe they have a denture. What are the best patients for this type of treatment?
Traditionally, patients that have no teeth are obviously great candidates for this, because they're either have nothing to wear or they have dentures that are not, the best dental prosthesis, the best solution. But for centuries, that's all we have, right? So patients that have no teeth or wearing dentures are great candidates for this therapy, even if they have heard in the past that they don't have enough bone. Because as we discussed previously, in the use of 4 dental implants allows to really choose the best possible angles and maximize the use of available bone left. Now, the majority of patients that are not doing really well. And this can be a wide variety of patients. Patients that are genetically predisposed to have gum disease, that are extremely prone to have cavities, that they had good dentists all their lives, but they keep having problems. They need crowns and bridges and root canals, and then everything breaks and they have to go back to fix the next problem. And during all this time, they really don't have the smile they want. They can eat the food they like, and they're insecure and they lose their self-esteem. So that's another great group of people that can benefit from this. Those that are having a lot of problems with their teeth and that are not doing really well. For a long time, Dr. Gardner, you and I know that patients and dentists believe that we need to save every tooth in a person's mouth. And that was true for many years. Having 2 or 3 teeth was better than no teeth. But today, in contemporary dentistry, in even my specialty, we have a position paper that says that it's okay to remove a few teeth if the outcome is going to be better for patients, because we're not going to send those patients home without teeth or with dentures. We're going to send them home with a fixed set of new teeth that will restore their function, their health, and giving them a beautiful smile, of course.
Thank you, and thank you so much for sharing these pictures, these beautiful pictures that help us to kind of get a better idea of the process. Like you mentioned, I know I came out of schooling very weary of removing any tooth that could be possibly saved. But I have learned in my practice at what cost to save that tooth. And at the end of the day, is it what the patient really wants? And is it what they desire?
That's absolutely right. If you let me interact, it's like it's about satisfying the patient's needs. We obviously want to save a tooth, but like this patient here on the screen, yeah, we can save those front teeth, but she was never happy with her smile. So the only way that we can correct the color, the size, the shape, the position of the gums, and giving her an ideal bite and function is with a replacement of teeth that will give you and I a blank canvas, so that we can treat the patient from beginning to end and giving them an optimal result. When we replace teeth, we have full control of the outcome. We have no excuse, Dr. Gardner and I, we have no excuse to not give patient a perfect result, because they're giving us the opportunity to start fresh and choose everything, the color, the size, the shape, the position of the alignment of every tooth, which is basically impossible to do when we're just fixing teeth. So the replacement of teeth gives us full control And Dr. Gardner and I, our commitment to our patients is to give them exactly what they want, regardless of what it takes us to get there.
It really is a wonderful thing for people who have just wanted something better and didn't want to be in a denture. And now we have this technology and this ability to, like you said, give them the absolute best. We can make it as beautiful, as white and bright, or as perfect and straight as they want, or make it look a little bit more age appropriate or more, natural, or maybe even incorporate little things about their teeth. Like, I always had this space between my teeth, or this little thing about them that I want to keep. And we have that flexibility to do that with this technology, which is pretty remarkable.
Absolutely. Every set of teeth is customized. We have, established, you and I, great digital workflows that allow us to make things better, easier, faster, improving the quality, and with outstanding aesthetics. And to be honest, some people may think that this is a little bit scary or state of the art, but it is. But actually, we and those cost savings to our patients. We want patients to have the best quality at an affordable price in a very short amount of time, and this is what it's all about. It's about changing people's lives and giving them health, function, and a beautiful smile.
Well, Dr. Monarres, thank you so much for your time today. We appreciate you being with us. If anyone would like to learn more about Dr. Monarres or about his practice, you can find them online at Stone Ridge Dental. And their website is implantsanantonio.com. And again, my name is Dr. Brandon Gardner here in Boerne, Texas at Gardner Springs Dentistry. Thank you, Dr. Monarres, so much for your time today.
Stay safe, everyone.
Thank you.
And I love your baby behind you.
She snuck in there at the end.
That's awesome. Hey.